of SCIE's webinars. This week we're going to be looking at the topic of strengths-based approaches, and we have a fantastic range of speakers who are going to make their contributions today. So thank you for taking time out of your busy diaries to be part of this. We do hope it will be a thought-provoking and stimulating session, and I think we'll leave you some ideas and thoughts about what you can do in your local areas to take strengths-based approaches forward. So many of you, I hope, will have come across the concept of strengths-based social work and social care, and will have probably realised too that it's become more prominent over recent years as a potential, and I say potential, solution to some of the challenges we face in care and support, with growing demand for services, very difficult financial circumstances, and a demand that we all produce better care and support for people who receive care. So it's a really hot topic, and I hope you enjoy the webinar that follows. So who have we got here today to speak to us? I'm Ewan King. I'm Chief Operating Officer at the Social Care Institute for Excellence. I'm really pleased to be joined in the room by Lynn Romeo, who's the Chief Social Worker for Adults based at the Department of Health and Social Care, and Rob Mitchell, who's the Principal Social Worker at Bradford Council. And for anyone who knows the Belgian Prime Minister, he is absolutely spitting image of the Belgian Prime Minister. And if you want to go on to Rob's Twitter feed, you'll see a photograph comparison, and you literally can't tell who is who. So anyway, moving on, we also have Professor Sam Barron, who is at Manchester Met University as well. She's actually going to be coming into the webinar via a recording, but she is going to be online to potentially answer any questions that you may have. So this is how it's going to work. We're going to provide some presentations. Lynn's going to kick off by setting the scene and discussing aspects of government policy in strengths-based practice and examples and ways in which you can implement strengths-based work. We're then going to be hearing from Sam, who's going to talk about the strengths-based practice framework, which was published by the Department of Health and Social Care a little earlier in the year. I'm then going to talk a little bit about some of the lessons SCIE is picking up through its work supporting the embedding of strengths-based practice locally, and then Rob is going to give us a really good insight into what they're doing in both Calderdale and in Bradford. So that's the running order. All of the slides, the recording, the chat that people are contributing to will be recorded and made available on our website in a couple of days' time. So you really won't miss anything. And do just come to me after the webinar if anything didn't work for you, and we can try and make sure we improve this process in the future. So without any further delay, I'm going to hand over to Lynn Romeo.
Great, thanks. And it's great that so many people have joined us today. So that's my name and that's my email, and I'm on Twitter, so do follow me. But I'll just go straight into the next bit, actually. Why is strengths-based? That's my annual report, actually, a little plug for my annual report. So do have a look at that, because it is very focused on strengths-based approaches and lots of really good case examples at the back, including a really good video, actually, of the way in which people looked at and built on the strengths of the young person with autism that they were working with, and had a really good outcome from that. Strengths, asset-based approaches has become the strapline, but I guess for me it's about really good social work practice and reclaiming and refreshing really solid social work practice. And why is it important? Well, up on that slide you can see the key things for me. It's about supporting people, carers and communities to find the solutions that are right for them. It really is about properly getting alongside people, and that power analysis and social justice principles that should underpin our social work relationship and the way we support and work with people is key. It's about what matters rather than what's wrong with people. We're not fixers, we're there to really identify with people what matters to them, what are the strengths and gifts and talents they have, and how can they be utilised to overcome some of the challenges that people are facing. And it's about what's possible out there and who really cares, and in that way of reflecting and improving how we work and the work that we do to serve people that we're working with in our local authority areas is really key, and making the best use of what's out there. Too often, I think, we've failed to really utilise the universal offers that are out there and the things that are available in people's local support networks, family networks and communities. I've just set out on that slide some of the kind of more detailed descriptions of some of the social work and strengths-based approaches that people take, ranging from ABCD, which is the asset-based community development approach. Lots of these techniques or approaches have been employed in different organisations and local authorities. I won't go through them all, but 3 Conversations model has gained a lot of traction as well. But all of these approaches are based on the same principles. So you may be developing or thinking about a particular approach, and certainly family group conferencing, although it started really in children's social work, is being utilised more and more in the adult sector, particularly working with adult safeguarding, but also now around more complex care and support planning with people and their families. So the policy framework actually does really support this approach, and the brilliant Mental Capacity Act really summarised it and captured it really well around people's rights, around how you really make sure you're taking their best interests into account, you're really listening and involving them in decision making. And the new liberty protection safeguards, which will come into play next year, will also build on that. The Care Act itself reframed and brought together social care statutory framework to ensure we really were focused on the principle of people's well-being and really using a strengths-based approach to doing or undertaking assessments and conversations with people, developing their care and support, and looking at outcomes. What difference are we really making? And hopefully, I know you'll all be thinking, when's that social care green paper coming out? As soon as possible is the answer to that, but hopefully that too will reinforce this approach. The Mental Health Act Review Report also is focusing on people's rights, social justice, principles of social inclusion, and that is also about trying to promote a more strengths-based approach. I won't go through all those other areas, but all of them are about consolidating that this is the practice approach we want to take. So there are some of the principles I've put up there. Focus is on throughout, we are the helping professions, and that is the helping is about looking at people's strengths, interests, knowledge and capabilities, and obviously balancing that with the needs and risks that may be present. So it's not about ignoring, of course, risks and needs and worries that people may have, but it's about balancing that with using focus on their strengths, interests and capabilities. Common themes are looking at, it's about your relationship or the relationships we have as professionals with people we're working with. It's also about the relationships we have with others, actually, other professionals or other agencies, the community and voluntary sector, housing officers and so on. That language does matter. The number of times I've spoken to people and they've talked about what a difference it makes when a social worker comes to see them and they do start off with those questions about, well, what matters to you? Tell me a bit about yourself. What are the things you've enjoyed? What's made a difference in the past? Rather than starting to say, well, what can't you do and what's wrong? It's an invitation to change our lens of perspective, one that we have strong, long historical roots in our social work development as a profession and our practice methodologies. And of course, importantly, that we're valuing people as people, that they're much more than and different from issues or challenges that they may have. Relationship work is central to that. How you use your professional relationship, how you really listen to understand, know and work alongside. Again, starting with strengths, questions rather than answers. We so often feel we're pushed into wanting to prescribe an answer when actually often people want to just talk through what it is that they're pondering on. And context matters, of course. So it's not about putting responsibility back on people and communities. It's not an excuse for cutting programs or dealing with austerity. It's not a tool for the neoliberal agenda. And we certainly can't get into that sometimes where it feels people have been blamed and for, in fact, what are structural disadvantages. And part of our challenge is to make sure that we use this strengths approach and use the political and power analysis that goes with it. We can't frame it as blind optimism. There will still be real challenges, and we still do have to campaign for a good, solid, financial, sustainable foundation for social care. And we can't downplay real and existing problems out there in our communities. So part of our role too is to campaign and challenge those structural inequalities. And formulas and prescriptive approaches, are not going to work. So there's a lot of talk about the three conversations approach, but that's only a tool or a framework to help people. You can't just give people a script and expect that that's somehow going to solve everything. In the end, social work is about relationships, it's about value-driven practice, it's about really understanding and talking to and with people so that we really get what it is that's going to make a difference, and we use the knowledge and skills we have available to support change and improve lives. I won't talk that through, but systemic and family narrative approaches also underpin this approach, and it is about thinking about some of these areas, and I wanted to put that up there because I think that's a really helpful baseline, actually, that people are experts in their own lives, that it's what goes on between people, and there are ways of reframing things that can really move things along more positively. So in terms of organisations, because as much as you, as practitioners, may wish to really take this on board and do it, you've got to have that organisational support for and senior leadership support for a new practice approach, which counters the kind of processy, assessment, eligibility-driven approach that's maybe been around for many years. So we've got to stop doing things to people. Often it doesn't work and it costs a lot. How often do we see now that people get overprescribed services which actually are not particularly helpful in supporting their outcomes? Really about listening not just to the people you're working with, but we need to be ensuring that everybody's listening to staff and utilising the strengths and gifts of our staff much more effectively. Reducing the kind of processy assessment referral process and investing more in what we do to build communities and to build solutions from citizens and neighbourhoods. So it does mean training people, because we have been trained in a particular way for many years, so it does mean supporting people to refresh and upskill their practice in terms of really focusing on what matters, not what's the matter, and giving permission to connect people to their communities. Just a few points there. I think we're learning much more now about isolation and loneliness as one of the key determinants of mental and physical ill health. A lot of this strengths-based, community-facing work is based on how do we really connect people and engage them with their neighbourhoods and communities. What can we do as social workers to still face communities and our neighbourhood approach, not just a very individualistic approach. Neighbourhoods are essential building blocks of public services. We know people trust their GP more than anybody else. They will go into their libraries often to get time out or time with people. We've got to use those opportunities to really build a more strengths-based approach to social care and social work. So I've just flashed up there two of the links to the resources. So we've got the Strengths-Based Social Work Practice with Adults publication, the framework that we produced following on from the round table we had in SCIE a few years ago. And there's going to be more said about that when Sam's brought into the conversation.
Okay, thank you, Lynn. That was really good. Okay, so just moving straight on, we have a recording of Sam, who's going to talk about the strengths-based practice framework that she helped develop with Lynn for the Department of Health and Social Care.
Hello, my name is Samantha Barron. I'm a Professor of Social Work at Manchester Metropolitan University. I'm one of the co-authors who have developed the practice framework, which was recently launched by the Department of Health and Social Care in conjunction with the practice handbook, which supports the development of the framework and also outlines strength-based approaches for social work. In developing the practice framework, it stemmed from a piece of work that Lynn initiated when she called a round table to look at sharing good practice around strength-based models. And if you look at some of the models, for example, relationship practice, restorative practice, signs of safety for adults, 3 conversations, they were all really good examples of models and what we can learn from strength-based approaches from these models. But when looking at some of the presentations, what occurred to me was that a particular model can have both a strength and a limitation, and that for social work, if we really wanted to focus on and embed strength-based approaches within our everyday practice, what we needed to do is have more than one model to draw upon, and also to have a range of models that we would embed and be able to choose from, almost a bit like having a repertoire of tools, models and approaches that we can draw upon in our everyday practice and change according to the people that we are working with. So the strength-based practice framework is known as the KVETS model and is based on the following five domains: knowledge and co-production, values and ethics, experiential learning, theories and methods, and skills and tools. And it's based on the premise that if you bring all of those areas together in your everyday social work practice, then you will actually be able to really make explicit professional practice around your strength-based approaches, but also be clear yourself as a practitioner what your practice is based on, what are the values of your practice, what's the theory and methods that you are using, what skills are required when using, what experience are you drawing on for your practice, and also what the knowledge base is of your practice, and of that knowledge base, which of that knowledge is being co-created by the experiences and knowledge of people that you are working with. It's quite established to have those 5 domain areas in any practice framework, but what it does in many respects, it's not new, but what it does is draw together what are the key components of professional practice for social work, and what should that be based on. So just starting first with the strength-based practice framework for professional practice. As you can see from the slide, what we have done is to take each domain area, so knowledge and co-creation as an example, and we've then looked at what would be the professional practice focus. So what is the knowledge that you need to have in order to practice in a particular way, and what is the knowledge that has been co-produced by the work that you have done with people, or in fact by different groups for people with lived experience who've actually started developing their own forms of new knowledge that we can build on as practitioners. What we've then done in the next circle is to put a reflective practice focus on, and we've used a technique called the art of the good question, because in supervision the art of the good question is quite an established technique that if you ask the right question you often get quite different responses that move away from procedural processes more towards professional practice. So in the reflective practice focus, we've asked a number of questions. So if we're looking at the knowledge and co-creation domain for professional practice, we'd be looking at, well, what strength-based model approach are you using? What is that knowledge based on? Where is co-production within that process? And the reflective questions you would ask as a professional practice as a professional practitioner are focused on, what does this mean to me? What does it tell me about my practice? What knowledge do I value? What are the gaps in my knowledge? What do I know a lot about? What do I not know a lot about? What relationship model do I value most and utilise? What systems are in place to develop or co-create within my everyday practice? So a range of questions are asked. And within the professional practice framework that focus on professional practice, we go through each domain. So we then move on to values and ethics and look at what are the values and ethics, what's your professional practice focus, how much is it based on human rights and social justice, do you look at the International Federation definition of what social work is, what does that mean to you? And then we'd ask a number of reflective practice questions. So what do I believe in? What drives my social work? How can social justice and human rights debates help me frame my work? What are the limitations of those debates? What are the limitations and ethical considerations of those issues when we are working in an organisation? And you begin to ask a number of questions. And you would look at those 5 domains: knowledge co-creation, values and ethics, experiential learning, theories and methods, and skills, and begin to look at what is my skills, what is my knowledge, what is my theory, what is my methodological approach, what are my values based on, and then ask yourself a number of questions. And what that begins to do is to really identify and draw out what your professional practice is based on, and how you can begin to look at, well, how do I use that in a strengths-based way?
Thank you. That was Sam, Professor Sam Barron, describing the practice framework. There are a number of slides that she talks through on a fuller video. Recording. There'll be a 12-minute recording made available with the rest of the materials when we publish that next week. And these are we're just going to quickly go through those slides that she talks through on that recording. But if you want to go through that recording, it will be posted in a couple of days' time. Okay, so it's back to me, and what I'd like to do is talk about some of the work that SCIE is doing and what we're picking up from working with now over 40 local authorities in England on helping them develop and implement strengths-based practice. Thinking about those areas that I think are further ahead and really doing great work on strengths-based practice, I think the following themes emerge strongly. I think those areas doing well tend to have a clear and compelling and regularly communicated story or vision or narrative, whatever you want to call it, that really encourages people to connect with this agenda and take it forward. And it's usually around the themes of this not being about money, but being about changing the way we work to improve outcomes. They tend to have a clear picture of the local assets and resources that exist within their communities, and they endeavour to spend quite a bit of time updating that picture and making that picture available to social workers and other staff. They tend also to have invested in an extensive and sustained programme of workforce development, from top to bottom, making sure that everyone is trained and understands what their role is in relation to strengths-based practice. They also know and acknowledge, I think, that strengths-based practice doesn't happen in a vacuum. It involves and needs a vibrant and well-resourced voluntary and community sector. It needs to be co-produced with local people. And therefore, they spend a lot of time at the start and throughout engaging with the community. In addition, I think they realise that good strengths-based practice arises through good co-production with people with lived experience and carers and families and wider communities, and therefore put in place arrangements that make that meaningful and real. And finally, I think they're aware that adult social care on its own certainly hasn't got all of the answers, and that increasingly other organisations play an important role. So, for example, as part of its long-term plan, the NHS is investing in personalised care and actually investing significant amounts of money in that. So they're trying to connect up with those kind of agendas to make sure we're maximising all the available resources in a community. Just realised it's me doing the slides. The other thing that we're fortunate enough to be involved in at SCIE is the creation of an innovation network funded by the DHSC, which seeks to bring together local authorities, commissioners and citizens to explore how we take the very best but often small-scale examples of good practice and good services and scale them up, to use the jargon, or grow them so that many more people can benefit from them. And what we've been doing as part of that is really thinking about how we can scale up strengths-based approaches right across a local area so that everyone can benefit from that way of working. And I'm just going to pick out some of the themes that have come out of that work so far. So obviously leadership is important, but it's a different kind of leadership, is what people have told us. It's much more about convening people, sharing power and building coalitions, rather than the more classic heroic approaches to leadership. Middle management is absolutely part of the focus and is often left out in the past when you're trying to implement something very different, and I'll touch on that a little bit more shortly. Just to pick out another one, another theme, people are increasingly commissioning new services with the voluntary sector all the way through the process of designing, commissioning and delivering new services. And I've given the Somerset as an example there, and throughout I've given some examples, and I'm happy to provide further information about what these organisations are doing on strength-based practice. I'm not going to read all of this out. The main point this is making is that if you're trying to implement strengths-based approaches, there are a number of different levers and changes you need to think about. You need to think obviously about leadership, and I've touched on that already, but also how you're working collaboratively with other agencies, with increasing importance and focus on multidisciplinary teams. You need to think about how you're measuring your performance. You need to think about how you're understanding and working with communities. So there's a huge amount you can do. And this slide is actually taken from one of SCIE's publications on strengths-based approaches in children's social care that we developed with Leeds Council. So do have a look at that. And finally, from me, returning to this theme of middle management, this is a group of people that often feel very pushed from above and very pushed from below as well, really caught in the middle of new policies, new requirements, and can feel that it's all too much, or it is just being added to an already very packed diary. So what we're doing with Surrey County Council is running a series of action learning sets with team managers, assistant team managers, to involve them in the process of developing a new way to deliver strengths-based approaches. So they're not just in a process of learning new skills, they're actually helping to co-produce processes, systems, and charters and behaviours that will be rolled out more extensively across the county. So that's just a final example from me. And here are links to some of the resources I mentioned in the previous slides. So I'm now going to hand over to my colleague Rob, who's going to talk about his experiences in Bradford.
Yeah, okay, so I've been lucky enough to work for 2 local authorities that have tried to embed a strength-based way of practice. So there's a few things that I want to say kind of before I come on to my slide really, which is want to agree with Lynn and the point that she made that this is, for me, this is adult social work evolution. I genuinely believe that we would have been doing strength-based practice without austerity, without some of the pressures that local authorities have found themselves under. This is a natural progression for me. Anybody like me that was kind of graduated in the 1990s and came into that kind of care management world was kind of screaming out for a return to social work. And actually in some of the work that I've done in previous local authority, we did actually call it come back to what you know, because we kind of feel that strength-based stuff is absolutely what we know. So in Calderdale, we worked, it was really interesting, we worked with a group of newly qualified social workers and some of the people that they supported, and we got a very clear challenge back from newly qualified social workers around strength-based practice. They loved it. They said it was absolutely what they'd been taught for their 3 years at university, but they made a challenge back to the local authority, because what they said is that they felt that it was hard to practice from within the walls of the local authority, from within the office spaces that they had. They were on the 5th floor, they felt kind of quite removed from communities. The local authority had centralised services quite significantly. So they made a challenge of senior management team to say that they felt that strength-based practice would be far better delivered if social workers were of the community and were back in the heart of the community. So we kind of asked them what that would look like, what that meant for them. And they said they wanted a shop front, they wanted a shop doorway. They said they wanted something that was quite tangibly different to the walls that we'd built up through fair access to care, where we're trying to filter people out. What they said is, let's open the doors, let's do some window dressing, let's kind of encourage people to come in and talk to us about social care, their social care issues or their emerging social care issues, and be strong enough and be confident enough that we've got the answers within the social care professions to actually be able to deal with people, rather than build up these walls and tell them that they're not eligible for services and to go away and come back when they are eligible. So that's kind of what we did in Calderdale, and that got us off to a really good start in terms of some of the strength-based work. It took us a while, I think, for us to kind of understand what the structures would look like and how it would actually work for social workers in particular. To start off with, we felt that social workers needed to be kind of protected a little bit and put further back in that kind of customer journey, for want of a better phrase. That was absolutely the wrong kind of thing that we did, and I kind of hold my hand up for that. The social workers needed to be right at the front of the journey. They need to be, as Lynn said and as Ewan said, they need to be having those relational conversations with people. That slow social, a colleague of mine talks about slow social work, building up that relationship right at the outset rather than push further back in that kind of customer journey. So that was important to us, really, that along the way you've got to kind of accept that you make significant mistakes, and we certainly did there. Another part of it was that you have to be, we felt that we had to have a very critically reflective internal conversation within the local authority and kind of properly study where care management from that 1990 Act had taken us to and the decisions that we were making, and actually begin to unpick the social work practice and where it had taken us to. That was quite a difficult conversation because we began to talk about the myth of safety. That actually care management was about us assessing as many people as possible, churning out care plans for people, support plans for people, and looking at services. But as has already been said today, services that are overprescribed or services that are prescribed prematurely can be as unhealthy and as dangerous as no social care at all. So we had to really kind of think about how we were going to work as social work and social care practitioners, and that needed a degree of critical analysis and reflectivity, which was difficult, but a much needed conversation. It kind of helped us to move on. In Bradford, different again, and I don't think you can build one model of strength-based that works for every local authority, for every health service, for all the people that you work in partnership with. Bradford has got more clearly defined localities perhaps, and certainly around diversity and strength of diversity in those localities. So it wasn't a shop front for us in Bradford, but it was certainly about social workers being out in marketplaces, being out in community centres, moving away from some of the more traditional kind of care management trappings that they had with kind of offices on the kind of fifth floor and away from people. It was about kind of really becoming one of the community. And some of the work that we've done in Bradford with NDTI, we've really worked to kind of map out what is actually out there in the community, because we know home care, we know residential care, and we know all these kind of Mary Poppins bags of tricks that we've churned out over the years. They haven't necessarily kept people very safe. What are the real community initiatives that are going on that the council doesn't know about, because the council perhaps didn't need to know about what was going on in the community, because these were led by other organisations. So we've done that. That piece of work has been absolutely vital for us. Another thing in Bradford as well, which has been important, is that we needed a theoretical framework to work from, and Lynn touched on this earlier. We've had some great support from external consultants, and it's about being kind of having some humility and recognising that we don't necessarily have all the answers within the local authorities and within the NHS, and sometimes we need a little bit of outside support. So we've had support from Empower that have really helped us with the three-tier conversation, and that's provided us with a really good, strong theoretical framework that social care practitioners have been to work from. It goes hand in hand with kind of relational social work. You can't just come up with a one-size-fits-all framework like the three-tier conversation and expect that things are going to change. It won't change. It's just another model unless you absolutely weave in that kind of that devolve power, those conversations, kindness, compassion, all those kind of things that brought us into social work in the first place. One of the other things, just if I very quickly go on to the slide, is that strength-based work needs to be underpinned by risk enablement. So I think that we're asking social workers, I think care management, was relatively unsafe for the people that we're here to serve. I think it was relatively safe for social workers, in that it was a process. This isn't a process. This is about better social work practice, and for that, I think we need a little bit of support from employers sometimes around things like risk enablement, ensuring that decisions and difficult conversations that social workers are having with people, with families, is underpinned by a commitment from the local authority to support them with the decisions that they're doing, that we don't kind of just leave our social workers out there and leave them to kind of get on with it. If we're going to do strength-based assessment, strength-based practice, it's got to be a whole organisation approach. In terms of the slides, there's just a couple of challenges that I wanted to kind of highlight about how we found things in Bradford. I've said relational practice will get you so far, but it doesn't explain why you need a qualified registered social worker. I think that we do need registered qualified social workers in the heart of strength-based practice, but I think our role is probably slightly different. I think we need to be legally literate, ensuring that people's rights are upheld, making sure that they have access to justice, and kind of recognise that the people that we're here to serve have probably got a lot more of the answers than we ever had in terms of how they define their needs, how they define their support, and how we actually support that as social workers. There's an interesting point made by our colleagues in Social Care Futures, which is if what gets designed depends on who's in the room, strength-based practice cannot be developed by the profession talking to other professionals. And I think that's a really important thing. This is a massive opportunity for us to get back to taking our lead from the experts by experience, the people that we're here to serve as social workers. Strength-based practice must be defined by the people who require social care support. That's in partnership with us. We've got an important role to play there, but that kind of co-design is absolutely crucial. And finally, that as we implement strength-based conversations, that we're seeing more contacts at the front door, more short-term support, that we actually make sure that the measures on what are good outcomes reflect that. So there was a report last week from King's Fund around social care, and it was still very much driven by volumes. How much social care have we delivered, or how little social care have we delivered as a result of some of the cuts to the council? The outcomes are the thing. The outcomes are absolutely the thing. If you have a lot of social care and you provide a lot of social care, it doesn't matter to the recipient if it's poor social care or if it's social care that puts them in a risky situation. So I think we have to kind of change some of the reporting metrics. I remember as a newly qualified social worker being asked by my manager, how many assessments have I done, how many support plans have I done, how many have I done within 28 days, how much social care have I churned through. We need to absolutely flip that on its head. I keep saying to the social workers in Bradford, the fewer Care Act assessments, the better, because I believe that you've had conversations with people. I can see it documented in better templates, in better case notes. There's fewer placements taking place in care homes now because we've slowed it down. We've got more of a relational kind of approach to our social work. So we just need to change some of those reporting mechanisms as well.
Thank you, Rob. That was really good, and allowed us to really look in depth at what's happened in two local authorities to implement a strengths-based approach. Right, so that's it in terms of the presentations from us. So we do have time now for questions and comments from you out there. I've already got a few. So Robert, I'm sorry to do this to you, but the first question is there was a question from someone about how you involved staff at all levels in the organisation and in partner organisations in developing this way of working.
Yeah, really good question, and it's really difficult. I think that's one of the things about trying to change models and break down some kind of old established routines and build up some new partnerships. I think it's been really difficult. So one example is kind of around hospital social work, where there is absolute pressure on the NHS and to ensure that people don't remain in hospital longer than they need to be. Actually, a strength-based approach, I think, is about relational social work. It is slower, and actually you don't always get that time when you're in those kind of acute settings. There has been, certainly in Bradford, lots and lots of joint work going on with our health colleagues to understand strength-based practice. I think some of it is about providing our colleagues across the NHS and anybody who's kind of sceptical about some of this approach or thinks that it is a cover for cuts, to provide them with an evidence base. One of the really good things that we're doing at the moment with Empower is we're collecting lots and lots of success stories where we're able to kind of share that with wider staff to say, look, this is what would have happened, we think, with that old kind of care management approach. This is what did happen with this new approach, and this is the outcome. And the outcome leads to people being discharged from hospital and not bouncing straight back into hospital because there's been a breakdown of services. But it is a really it's a difficult one. One of the other things, just to say very quickly, is that so newly qualified social workers have kind of been grounded in this, as we were when we were all at university, because none of this is new. This is stuff that's been around for a long time. This is absolute good social work practice. So some of the newly qualified social workers have been able to kind of take a little bit of a lead role on it. Now that's got some advantages in that you've got people who are kind of fresh and enthusiastic and can kind of lead on it, but they haven't got the experience behind it. What's been kind of more challenging and still is an issue for us is actually how we engage staff that really were, like myself, but really were schooled in that old kind of care management way of doing things. That, for us, that's been about bringing people out of the work setting, getting them into kind of classrooms, bringing in people like National Development Team for Inclusion, bringing in lots of experts by experience and having those kind of conversations. And it is a little bit of an ongoing narrative in Bradford that this is kind of come back to what you know. This is only good social work practice. There's nothing new that anybody's been taught here. What it is, it's a series of permissions that are given for people to go back and do the social work that they were trained to do.
So another question or comment really is what is the role of OTs, GPs? There's quite a few different professional groups being mentioned. Lynn, any views on that wider picture of other professions?
Yes, I mean, obviously we've focused today on social work and social work practice, but in most places where they're adopting this approach, occupational therapists, other social care workers are involved in this as well, and occupational therapists have as much of a role to play in strengths-based approaches as do social workers. And in fact, a lot of the work around engaging people and connecting them to meaningful occupation, which will improve their outcomes, is a strengths-based approach. So definitely occupational therapists have as much of a key role to play in this as social workers do. In many of the more developing primary care networks, integrated care organisations, many local authorities are moving to work with neighbourhood approaches or cluster approaches, lots of different names for it, but roughly 30 to 50,000 population basis where it is about the health and social care system and the practitioners within that taking a much more community strengths-based approach. And you will know now that GPs are in that space with their social prescribing. I know we don't particularly like the name of it, but essentially is it about trying to identify what's strong in this person, what things can they be connected to which will improve their health and well-being outcomes. I have some examples up in Salford. They're a completely integrated care organisation now, and they are taking an approach where they're going to be working with all of their staff, all of their practitioners and the community and voluntary sector to very much frame their approach through this strengths-based approach. And GPs are also very keen on that, and the Royal College of GPs are also supporting this approach as well.
Brilliant, thank you. Quite a few comments building on what Rob was saying earlier about having social work teams, social workers based in the heart of communities, and I've even had suggestions up there about having social workers in supermarkets and social workers where people come together. And I know that actually in York and in I think it's Barnet in London, they have these talking points, which are basically sessions you can come in with an issue, a concern, and meet a social worker in the community just to have an initial conversation about what might be needed and what support might be available. So I know that's a good way to have to make sure that people can access care and support. One question that's just come up is about how do strengths-based approaches support people on the margins and particularly people with living chaotic lives. I'm going to just ask Rob to maybe have a go at that.
Another good question. My experience in Coldsdale was interesting about people living kind of chaotic lifestyles. The shop front that the social work team moved into was in a part of the town where there was quite a lot of people living chaotic lifestyles. And one of the comments that I remember kind of early days when people were a bit sceptical about this move were, oh goodness, if you put social workers in a shop down that part of town, they'll be inundated with people with chaotic lifestyles and people with all different kind of drug and alcohol problems. And our response from our director was good. That's what I want my social workers to be doing. They are the communities that they need to be engaging with. And that actually happened, that the social workers within that shop front in that town actually did some really, really good proactive work with people that were leading kind of chaotic lifestyles. In contrary to what we'd done previously, because what we'd done previously is anybody kind of approaching us, we'd used that wall, that false wall of fair access to care, to actually screen people out. It didn't feel right for social workers to do that. We are trained in supporting people to access social justice. We understand, I think more than any other profession, because of the qualification that we've got, we understand structural oppression and discrimination. And people who are marginalised and are leading chaotic lifestyles need support. And I think strength-based approaches kind of gives us that permission to do that. One of the things that I would say about people that are leading kind of more kind of chaotic lifestyles or on the margins is that it kind of comes back to the point that I made earlier about what social work's role is within strength-based assessments. I don't think social work's role is controlling this and managing this in a way that we manage the old Community Care Act, with churning out assessments and kind of keeping it within social work parameters. I think our role is empowering people and ensuring that their rights upheld, their human rights upheld. People that are living on the margins with chaotic lifestyles that might dip in and out of support from statutory agencies. I think that's what the role of the social worker is to do, to be there for that particular person as they need that social care input and that social care support. It's not to offer them services, it's not to drag people in with a small dollop of social care that then becomes, more social care until we conveyor belt somebody in towards a care home placement. It's to absolutely accept that person is probably going to lead a chaotic lifestyle for probably a lot longer to start with, that we're not here to impress our values on people and to actually change that kind of chaotic lifestyle into a lifestyle that we would prefer. It's to accept the risks as they are presented to that person, and it's to be the social worker that we were kind of trained to be. But it is a really difficult one.
Thanks, Rob. So really good ideas coming up on the screen in front of us here. So I'm hearing about a social work surgery in Knightsbridge, bringing together GPs, OTs, social workers. I'm assuming that's a Knightsbridge in London just next to Harrods, which is hard to picture, I'll be honest, but it's a great example. Then there are some examples being given of how local teams are trying to pull together social prescribing and core social care services, which seems absolutely sensible. So there's a significant amount of resources going into social prescribing. Whatever people think of it, it's not in my opinion, a perfect way of working. It is providing additional resources into local communities, and I think there's an opportunity there to shape how social prescribing is going to work in the future. There's quite a few requests for people to bring these examples and good practice case studies together in one place, and SCIE is certainly going to find ways to make more of these examples available, because I think we have that potential to bring it together in a single place for people. Okay, any other questions there? Can we see?
I'll just go there. I did notice one question. Somebody asked about motivational interviewing, and I'm sorry that slipped off my slide, but that was there before actually. And motivational interviewing, again, is another strengths-based approach to working with people, and particularly with people with substance misuse issues, but also it's starting to be utilised more broadly, working with other people as well. So there are lots of different things that you probably out there know a lot more about than we do here. So I welcome people getting back to me and highlighting approaches that you feel should be kind of promoted and highlighted as additional ways in which people can work effectively with people. I also noted earlier somebody asking about the Mel Gray piece in the journal, kind of challenging the kind of strengths-based approach that's not just in this country but in many other countries being promoted, and some of the kind of weaknesses or areas of challenge, and is there a real evidence base for it? And that is an interesting question actually, because I think we're only starting to build an evidence base actually, and this is one of the I suppose weaknesses in social work, is that we haven't been very good at capturing what are the approaches that are most effective and do deliver best outcomes for people. So I think there will be real opportunities over the next few years to try and ensure we do research and evaluation into these approaches, and then actually gather the evidence as to whether it is more effective taking this approach, so that we can then promote it more effectively as a way of really supporting and helping the people we work with.
Okay, so I'm not seeing any new questions or any further questions that you'd like to us to answer. Can you see anything that is worth picking up on? Right, one from Karen Johnson. Would be really interested to discuss your experiences of the Casey Vet model. So, Sam is still online, and she's happy, I think, to provide you with an answer. Maybe get in touch with one another so she can talk you through how that works. It's as I've said earlier, it's all explained in a bit more detail in the recording of Sam that we're going to post up next week. And it's also described in depth in the framework and handbook that the DHSC published earlier in the year. One good comment I saw earlier was that there is a lot to learn from local community-based voluntary sector organisations, and that's absolutely the case. So SCIE, Shared Lives, and Think Local Act Personal are running this innovation network at the moment, and there are 20 or so community-based voluntary organisations which are just doing some fantastic work. One of them has already been mentioned there, Shared Lives, a fantastic model of strengths-based practice. The local area coordination is another one. So we hope to be publishing much more about what those organisations are doing to support strengths-based practice. But absolutely, the more you engage with the voluntary sector on this, I think the better, because you learn from one another, and through that engagement build more resources and opportunities. Come in. Yes.
Sorry, there is a question about learning disability and sensory needs. It's just gone off the screen now. Just to say, we are in the process of developing a capability statement around social work practice with people with learning disabilities and also with people with autism. And there has been a guide produced around working with people with sensory needs and deafblind people. So again, we'll try and refer you to those. But we are also BASWA and RIPFA are working on the capability statement, and it will be very much based on the kind of strengths-based approach. Now, I think what underpins all of this for me is the relationship-based, the relational social work approach, driven by that underpinning values of human rights and social justice, and really enabling and empowering people to self-actualization. It sounds like very old school type social work terms, but that's the key mechanism, actually. Yeah. And certainly with people with learning disabilities, that is the strengths-based approach that they really said mattered to them. People who really listened and understood and walked alongside of them and challenged the kind of structural obstacles that they were offering in place that stopped them leading good citizenship and inclusive lives.
Thank you. Rob, did you want to come in there?
So there's a couple of comments I want to pick up on. I think Tim made a comment about social workers kind of giving a hand up rather than kind of a handout. I think that's absolutely right. I think there has to be, it's a point that I have made earlier, and if you don't mind me making it again, I do think that within the profession we have to have some humility to kind of keep coming back to this kind of this critically reflective point about kind of how social work might have been, how social work might still be perceived by some people, and how we actually work to devolve power. I think that strength-based practice is absolutely right. I think unless it's properly underpinned by a determination to devolve power, to genuinely treat people as citizens and realise that the old kind of Mumby quote that servants not masters, then the danger with it is that it just becomes another model in the way that care management becomes another model. It has to go hand in hand with our social work values, and that's the real driver really for social workers within local authorities and occupational therapists and other allied kind of social care professionals, that we absolutely want this as a model of practice, but we don't want it without that genuine kind of value-driven stuff and that shifting power between the state and the citizen. I think is absolutely vital. And I think social workers social care practitioners, we've got the legislation, certainly for the first time in my career, we've got the legislation, the Wellbeing Principle of the Care Act is absolutely our values enshrined in law. And now we've got that as a tool to use when people are making decisions that they want to make, that they are the experts of their own conditions. We've also got the as Lynn touched on earlier, we've got the Mental Capacity Act, which I think is actually a bigger enabler than the Care Act itself. That those 5 principles, if those underpin everything that we do in terms of a strength-based practice, we can't go far wrong, really. And I think keeping social workers legally literate is absolutely vital. So there's a question earlier about a coaching role or a mentor role, and how do we do that around strength-based practice? Well, I think we do that through things like the teaching partnerships and other bits of money that we get. Certainly that's what we've done in Bradford, that we're developing the coaching arm alongside the university to kind of help us not just kind of embed a model, but embed a way of working for the next 10, 20 years. And that needs a little bit of investment. It needs us to think a little bit creatively about some of those kind of workforce budgets and ensuring that.
Thanks, Rob. We're almost at the end, actually, of our time with you today. I just wondered if I could ask Lynn for any final comments and Rob for any final comments, and then we will have to wrap it up, I'm afraid.
Yeah, just a final comment from me. As well as taking this practice approach with people we serve, I think it's also really important that it's embedded in the support and supervision that social workers have access to. So taking a much more strengths-based coaching, mentoring approach to supervision and reflecting on practice, and ensuring that we're equally mirroring that in the way that we support social workers and OTs and others undertaking their work.
It's for me, it's fantastic to see. I kind of feel like I've learnt more than anything that I could tell anybody over this webinar by just reading the comments that have come through and the different ideas. I do think we need to kind of concentrate about how we pull all this together, because this is really kind of rich stuff. Just to say that, as I say, I feel like I've learnt more than I've actually told people, but I am really kind of interested in talking about the experiences that I've had in Bradford and I've had in Calderdale. And if anybody wants to make contact with me via Twitter at RobMitch92, I'm more than happy to come out and meet people and kind of discuss what we've done in Bradford, what we did in Calderdale, and what you're doing in your local area, so we can learn from you as well.
That's a fantastic offer. So SCIE will certainly do its bit to try and pull together good practice examples, host blogs, make sure that all of these reports are available. I think we're now out of time, so I really do want to thank you all for taking time out of your diaries today to be part of this webinar, and I hope you take part in future webinars. So thank you, everyone.